So I was seeing another physician for about a year with some chronic pain I was having in my left forearm that was progressively getting worse over time. One day I was working with a friend of mine and the hammer slipped out of my hand and almost hit him, at which point I knew something had to change. I was seeing a physical therapist, Matt Carl. Matt mentioned to me that he had gone to a seminar and was listening to a gentleman by the name of Dr. Manuel DaSilva talk about this procedure he did. Matt felt that after that seminar, he could really help me. Because it had been, like I said, a year now with no success, a number of steroid shots that were minimally effective at best for a very short period of time. So I called and was fortunate enough to get an appointment, which actually didn't take that long. He asked me to do a few different exercises, not really exercises, but tests, and looked at me straight in the eye and said, I can fix that.
So he had pain on the medial side and the lateral side of the elbow, commonly known as tennis elbow and golfer's elbow. It's usually referred as tendinitis, which implies inflammation, but this is more a degenerative condition, usually caused by chronic overuse and repetitive strain.
There was, without a question, I went home, said to my wife that I'm going to get this fixed, and this is who's doing it.
So this did not exist. I've been doing this for approximately 20 years now. It is deceiving because what you're seeing is very tiny incisions on the skin, but is essentially the same type of work that I would do with an open incision. I'm doing with the camera and with a mechanical shaver.
Think of it like somebody has a knife stabbed into you and all they're doing is turning it, and that's how it feels all the time, and then they take that out. Well, you don't have that stabbing pain anymore. It still hurts because there's a hole there, but that pain is gone, and it progressed faster than he said it would. And within no time, I had full ability with squeeze strength, ability to exercise again, which I was having a lot of trouble trying to get through. So it was well worth it.
That's the ultimate goal, is to fix the problem without causing any problem for the patient, and I think that this arthroscopic technique does that.
You know, it's hard to describe being an athletic outdoor person. That's a pretty big part of your life, and it's a pretty big part of your mental, well-being. So for me, it was outstanding. Phenomenal is probably the two top words I would use. You can say thank you, but I don't know if thank you really covers, how much it changed what I was able to do again. They are an outstanding top shelf facility, and I would recommend them to anybody. I have recommended him to everybody.